Untreated sleep apnea can lead to serious complications. So how do you know if you're at risk? Our 9 Health expert has an easy screening you can take from the comfort of your own home as part of our new 9 Health series, Prevention During a Pandemic.
Sleep apnea means simply lack of breathing while you're sleeping. And there's actually 2 different types of sleep apnea. The first is called central sleep apnea, central because it occurs in the brain, which is the center of the body. And that's where your brain basically tells your respiratory muscles or forgets to tell your respiratory muscles to breathe. So it can happen because the brain is not sending the correct signals to the breathing muscles while you're sleeping. The second type of sleep apnea is called obstructive sleep apnea. Obstructive because there's usually obstruction that occurs in the neck or throat area. So let's talk about obstructive sleep apnea because that's the most common type of sleep apnea in adults. And the risk factors, as you can imagine, are related to your weight. So if you're overweight or obese, that can certainly increase the weight on your neck and cause pinching of that airway while you're sleeping. Other risk factors can be having a large neck circumference, being male, having a family history or genetic predisposition to sleep apnea, being older can also cause obstruction, having chronic sinus congestion, and then finally smoking, excess alcohol use, or use of sedatives before bedtime can also disrupt your sleeping patterns and cause sleep apnea. Signs and symptoms that you may have sleep apnea include snoring, although you don't have to have snoring in order to have sleep apnea. One of the most sensitive signs that you may have sleep apnea is daytime somnolence or fatigue. So if you're someone who feels tired often during the day or feel tired when you wake up first thing in the morning, that may be a sign that you might have sleep apnea. There are things that we can do as individuals to prevent sleep apnea. So the first is to really maintain a healthy weight and exercise regularly. The second is to minimize the use of substances such as alcohol, cigarettes, or sedative pills, anything that can disrupt our sleep patterns. We should also have a really good sleep hygiene routine. So going to bed at the same time every day, waking up every day. Sleeping on your side can actually also minimize your risk of having sleep apnea because when you sleep on your back, the gravity can actually cause more obstruction of the airways. The 9 Health online sleep apnea risk assessment is a questionnaire that takes just a few minutes to complete. It asks about difficulty breathing, congestion, snoring, neck collar size, sleepiness during the day, and your chance of dozing. You will add up your score and then it tells you what your results mean so you can follow up with your healthcare provider. But basically anyone with a score greater than or equal to 18 would likely need further testing. It is more important than ever to keep tabs on your health and get ahead of your problems before they become a bigger issue.